Myself, Rashmi Limbachiya, nursing tutor of DINSHA Patel College of Nursing. Today I am going to teach about the nursing diagnosis topic. It is a step of the nursing process. The nursing process is include the assessment, nursing diagnosis, planning, implementation and evaluations. In which I teach about in detail the nursing diagnosis, how to write nursing diagnosis, definition, types, all about. First of all, I teach about the definitions. A clinical judgment about the individual, family or community response to actual or potential health problem and life process. Nursing diagnosis, it means it is a clinical judgment in which the families and community persons and patients also include the problems, and according to patient problem and symptoms you write down the nursing diagnosis. A nursing diagnosis is provide the basic for selection of nursing intervention to achieve outcome for which the nurse accountable. Okay, in which the nursing diagnosis is provide to basic selection of nursing intervention. Okay, intervention, it means planning, how to provide the care to the patient. Next is a professional nurse are the responsible for making the nursing diagnosis. Okay, professional nurses are the making the professional nursing diagnosis, which is followed by the Nanda diagnosis. Nanda nursing diagnosis, in which the diagnosis meaning it is the statement and or conclusion regarding the nature or phenomena. Okay, what is the diagnosis first of all? The diagnosis, it means it is a statement of the regarding to nature of the phenomena, means patient's conditions. Okay, and diagnostic label, it is the standardized the Nanda's names for the diagnosis and diagnostic label. Okay, only diagnosis, it means it means the statement and conclusion of the nature, but then the diagnosis label in which the standardized Nanda name for the diagnosis label. Okay, it means the professional diagnosis is followed by the Nanda diagnosis. Like example, a proper nursing diagnosis may include ineffective breathing pattern related to pulmonary hypoplasia as evidenced by intermittent subcostal and intercostal retractions, tachypnea, abdominal breathings, and to need the ongoing oxygen support. Okay, in which the example, the first the red line is the ineffective breathing pattern. How to these symptoms like related to pulmonary hypoplasia and as evidenced by intermittent subcostal. Other symptoms are like tachypnea. Okay, respiration rate person and pulse rate are will be increased. That time the you write this diagnosis, and it is the Nanda's label diagnosis. It is a state clear and concise health problems. It is derived from the existing evidence about the clients. It is the potentials amenables and to nursing therapy. It is to basics planning and carrying out of the nursing. Okay, what is a nursing diagnosis? The nursing diagnosis is a conclusion of the health problem, and it's derived the evidence base of the clients and potential nursing therapies, how to provide patient care, how to improve patient cares in which. Okay, next the type of nursing diagnosis. The first type is the actual nursing diagnosis, risk nursing diagnosis, health promotion nursing diagnosis, possible nursing diagnosis, and syndrome nursing diagnosis. Okay, there are many types of nursing diagnosis, but there are the divided, like some health related, some symptoms related, some risk infection related in the hospital, some syndrome like. Okay, the first one by one see. First one is actual diagnosis. What is actual diagnosis? which the clinical judgment about human experience, response to health condition, life process that is exist in a individual, family or community. Okay, actual diagnosis, it means that clinical judgment like history taking, okay, in which the you take the history and patient will be telling about the symptom. I will suffering like nausea, vomiting, that is like actual diagnosis. The actual client problem present at the time of the assessment. Okay, whenever you assessment that time present the symptoms, that is actual diagnosis. It is the based on the presence of sign and symptoms, like for example ineffective breathing pattern, disturbed sleep patterns. Second one is risk nursing diagnosis, in which it is a clinical judgment that a problem doesn't exist, but the presence of risk factor indicate that the problem is likely to develop unless nurses intervene. Okay, it means the patient have suffering already some disease condition, but the patient have risk to other patient, other conditions because of low immunity. That time you write down the risk of factors. Okay, in with no subjective or objective cues. Okay, that time the patients are not saying the like telling that, but that time no subjective data and objective data. It is a directly clinical judgment by the nurse. Okay, and surrounding to environment and patient's condition, depends on patient conditions. Example, the client with the diabetes mellitus or compromise the immunity system is high risk than all others. Okay, it means the diabetes mellitus patients will immunities are very low, so that time the higher risk than this patient. The immediate, the like COVID-19 example, that time the COVID patient with the diabetes mellitus, that time the easily to catch up and easy to diabetes mellitus patients suffering to COVID-19. So high risk of the low immunity patients. Next, describe the human response to level wellness and individual, family or community that have the readiness and enhancements. Okay, that time that you have described the human response and level of wellness. That time you give the health education to the patients and have them relatives, and the clinical judgment about the person is family and community motivation to desire increase well-being. Readiness for enhanced family coping, readiness for enhanced self-esteem. Okay, enhanced coping, it means that this is a diagnosis like the some doing the procedure the person nurses into on the patients. Okay, that time the you have to convince the patient for the coping. Okay, that time sometime patient have suddenly the suffering cancer. Okay, that time patient are not coping like that, I am not suffering like cancer. That time you have write this diagnosis and you have teach about and give you have the give health education and they adapt the conditions. Health promotion nursing diagnosis, it's also possible nursing diagnosis. Okay, a possible nursing diagnosis is one which the evidence about a health problem is incomplete or unclear. Okay, in which the possible nursing diagnosis, it means the one of the which evidence about the health problem is incomplete and unclear. Like whenever time the patient have many conditions and not find out the final diagnosis disease condition, that time you have write the possible diagnosis. Okay, whenever patient symptoms and conditions, okay, not according to disease conditions, that time you write possible diagnosis, in which the possible social isolation related to unknown etiology, potential risk of the constipations as result to enforce the bed rest. Okay, in which the you have to like COVID-19 patients, you have to all around person, family person you treat about the Isolation. Okay, whenever the not collect the patient's COVID positive report, that 2 days, 1 days of reporting, that till the patient will be isolation, and when the patient is negative, that time you have to move and explain there is a negative and not require the isolation, but it is a not disease will be a finding, that time you have right possible diagnosis. Syndrome nursing diagnosis, in which the clinical judgment describe a specific cluster of nursing diagnosis. Okay, in which the like the specific conditions. Okay, like specific cluster of nursing diagnosis that occur together based addressed together through the similar intervention. Okay, in which the like rape patients, like rape patient will be a very sadness, very different diagnosis, the alone person, that time someone death, loved one death, that time you write like diagnosis. Okay, in which like rape trauma syndrome example. Components of nursing diagnosis. Okay, components, it means the content, how to write, how to depends on the nursing diagnosis, how to writing the nursing diagnosis. The first is a problem. Okay, you have to ask question to the patients, what is your problem? Okay, what are you suffering, symptoms, sign and symptoms, that. Second is a define the characteristic. Okay, and theoretology etiology. Okay, what is the cause actual? So nursing diagnosis is writing the depends on problem, etiologies and characteristics. Okay, are ready to plan care? Okay, like